With the use of a specialized table during hip replacement surgery, surgeons are able to manipulate and operate on the leg with minimal trauma to the body. Dr. Louis Stabile discusses the new enhancement to these surgeries at Desert Regional Medical Center in Palm Springs.
Well, the anterior approach for hip replacements is thinking outside the box. It's not typical of hip replacements. Typical hip replacements, patients are on their side, and with our anterior approach, the patients are on their back. And with the use of the table, we can manipulate the leg and use accessories on a table to deliver body parts, the upper femur for instance, into the wound that we can put the implants in without as much trauma or without as much injury to the surrounding muscles. It's a very personal decision to have a hip replacement, certainly not a decision that I make. I give the patient all the information required. We try the conservative route first, and then if things fail, then typically we arrive at agreement together for a decision for a hip replacement. The traditional, what we call the Smith-Peterson approach, which is the anterior approach to the hip, involved going anterior to a lot of the major musculature in the hip. But the reason why it was not done is because the femur was very difficult to access. Without this operating room table, special table, which was developed by the surgeon who perfected technique, it was very, very difficult. Oftentimes you could traumatize some of the anterior muscles, but the table has revolutionized the approach in that it allows access to the femur to be unparalleled and also access to the socket to be unparalleled, and then with that we can have the exposure we need together in conjunction with X-ray to implant the implants or shall we say put the parts in the right position. It also allows us to have patients have unrestricted weight bearing and unrestricted motion. Traditionally, even small mini posterior incisions, patients are usually restricted from bending down, touching their toes, or putting on their shoes for the first 6 weeks. For the anterior approach, there's no restriction, and a few patients I've had have put on their shoes or socks the next day after surgery. With the use of this table, there are need for the personnel to be comfortable with the use of it. Assistant ancillary help, such as nurses, are necessary in order to operate the table and position the extremity the way I like it. And they've actually been trained by the people who developed the table. In addition, the X-ray people who are in the room, who take X-rays of the hip during the surgery, have to know what type of X-rays they need to see, and they've been trained. They've actually been to the place where they've done the most of them, and they've gotten a lot of experience. So now we have a well-oiled machine. So this is what I wanted. This is the time and effort that it took to get there, but I think we've arrived, and I think I'm very proud of what we've built here at Desert. The patients require a lot less pain medications and usually are on pills just about the day after surgery. They're up and walking, unassisted, usually by about the 5th to 7th days if they're young and motivated. They're extremely happy. What I call the break-even point, where the surgical pain is less than the pain they had before, it approaches just a few days. So it's the recovery, I think, is astounding.